Now today, we are exploring the complex world of digestion, focusing on two common yet often misunderstood conditions, GERD and dyspepsia. Imagine your stomach as a bustling factory. GERD is like a faulty conveyor belt, allowing acid to spill back into the esophagus, resulting in that fiery heartburn sensation. Now, dyspepsia, on the other hand, is akin to the factory workers feeling unwell, grappling with bloating and discomfort in the upper abdomen. Both conditions can disrupt daily life, but they each tell a unique story. Now, to shed light on these digestive dilemmas, we have the expert guidance of Dr. Paolo Demapelis with us today. It's a beautiful day, Dr. Paolo. Hello there.
Hello, good morning.
Good morning. Now, first and foremost, can you please explain to us the main differences between GERD and dyspepsia? Una-una, ano ba yung GERD and ano ba yung dyspepsia? And how do they affect patients differently?
Okay, so GERD and dyspepsia, they are both hyperacidity in general. There is decreased acid in the stomach. But what's the difference? That in GERD, there is a weakening of the lower esophageal sphincter pressure. The lower esophageal sphincter pressure, you can imagine it is like the gate between your stomach and the esophagus. Now, if it's weak, the acid tends to go up, and then there will be heartburn, and there will be acidic reflux. That's the main difference. But there are both hyperacidity in both of them.
All right, Doc, so we're going to try and get your connection just a bit clearer here kasi medyo
Yes.
garbled ng konti. But
Sorry.
no
Yes,
worries.
yes.
But at the same time, kasi right now I've been actually hearing more about GERD and how people are managing it. A lot of people go through diets. A lot of people try to deal with it in different ways. For those who don't know that they have it, ano po mga symptoms that may be leading to GERD, and of course, what people should consider if they start feeling a certain way that, uy, baka may GERD ako?
Okay, so first and foremost, let's start with dyspepsia. There is like a burning sensation or like a pain in the upper abdomen, especially in the central part. And then, if you have acid reflux, there is like a feeling that there is like an acid going up from your stomach to your chest to your neck. And sometimes there's what we call heartburn. Heartburn, some people may misunderstand it as like chest pain or like difficulty of breathing or palpitations. That's why it's called heartburn. So those are signs of acid reflux. And the ones that are less common are halitosis or bad breath. And sometimes there is like a different taste on the mouth or what we call water flash.
Doc, you mentioned din sa dyspepsia. Are there any common triggers? Like, what starts it in general? Are people just born with it, or do we do things in our daily lives that we don't realize that it's actually contributing to either dyspepsia or GERD?
Okay, so of course, you are born with it. Long story short, if you have GERD or dyspepsia, you're bound to have it for the rest of your life. It's a chronic disease. But what triggers it, what starts it again, is actually stress. The most common one is stress and anxiety. That's why we see it in many patients with anxiety disorders, and those people feeling very stressful environment. But other triggers include overeating, for example, pain or in gathering, that you eat a lot at one time. Also certain medications like antibiotics, pain relievers, and also there's the bacteria called Helicobacter pylori that causes ulcer in our stomach that can also trigger it. And this one we diagnose this through endoscopy.
Now, Doc, you mentioned stress, anxiety, and eating a lot at the same time. I feel like that's all of us. But how important is lifestyle modification to manage both GERD and dyspepsia? And what do people need to do so we prevent having it? Or if they do have it, what should they do to manage it?
Okay, so lifestyle modification is just half of it. So one of the things that most people should do is eat slowly. What I tell patients, you can eat if you have like a big meal, you can divide it into portions and eat them in portions. Another one is what we call head of bed elevation. It's kind of tricky, but you have to put a triangular shaped pillow or a wedge fold pillow under your mattress so that it's elevated. And then another one is avoiding trigger foods. So trigger foods, this is the long list of what we coffee, chocolate, soft drinks, spicy food, oily food, potato-based food, citrus-based food, alcohol, and smoking. But these trigger foods actually vary from person to person. So, for example, it doesn't mean that I have trigger in spicy food, you have trigger in spicy food, and other people's in coffee. So, you have to look for your trigger food. And then once you find your trigger food, you have to more or less avoid it or limit it. Because there's like limit which you can take with trigger food. But overall, you can take a little bit of it and not trigger your acid reflux. Other ones is avoid eating 2 hours before sleeping. Another very important lifestyle modification is weight loss. If you are obese and overweight, weight loss contributes also a lot in reducing the acid reflux. And of course, the most important of all is health-seeking behavior. So you go to see your doctor, your gastroenterologist, and your doctor so that you can be given medication.
Doc, you already mentioned like certain medicines and antibiotics to treat GERD and dyspepsia. The symptoms of GERD can be mistaken for something else. So what happens? Kasi mahilig tayo mag-WebMD, right?
Yes.
Self-medicate. So what happens if GERD is not treated at once? Does it lead to an even more severe condition?
When it comes to GERD and acid reflux, GERD and dyspepsia, for people like years, I have seen patients, it took them 5 years, 10 years before consulting doctors, especially those in poor communities. Some of them tend to have big ulcers, and these ulcers tend to bleed, tends to get perforated. Those are the very bad ones. But of course, GERD and dyspepsia on its own is very difficult. And it's very difficult for patients to handle. That's why usually seek the doctor right away because it's kind of difficult to tolerate once it's getting worse. And for each attack of acid reflux and dyspepsia, it can only get worse.
Doc Pao, okay, let's try something first to try and get your audio fixed. If you could shift instead from using your earphones as your microphone,
Okay.
baka we
I'll try
might
that,
hear
I'll
you
try
a
that.
bit better. But Doc, while you're fixing that,
Can I be heard better?
yes, that's better, Doc.
Yeah.
Thank you so
Better?
much. Doc, right before we let you go, for those who are wondering about if there's any other treatment options or things that they should do to help manage it, what would you say is the best way for patients who suspect that they have a GERD or dyspepsia to actually do in terms of consultation and, of course, any preventive treatment?
Well, preventive treatment is actually very difficult because once you have an attack of GERD or acid reflux, it can only get worse. And the best way really is just have a consult with your doctor and be given the right medication. That's really just the best one. And I tell my patients, you just expect that it will attack in the future. I already set their expectations that in a year or so after a very good treatment, it will really come back and will just give you medication again.
At mangyayari, and that's something we should watch out for. Doc Pao, if anyone wants to reach out to you or follow any of your content, or of course want to be able to get any of your advice specifically, how can they reach out to you?
Okay, of course, the best way is through my Facebook page. I have a Facebook page, Dr. Paolo Demapelis, adult gastroenterologist. You can search it. You can search my full name on Facebook, and my Facebook page will come right up.
So we are now going to try and flood your Facebook page with invites, with likes, and hopefully some additional consultations.
Yes.
Dr. Paolo, maraming salamat. We hope we can have you here in studio next time.
Thank you very much also. Thank you for
to
the
avoid
invite. Thank
any
you.
of the issues with connections. Maraming salamat, Doc. Thank you very much.
Thank you.